At the Robert Wood Johnson Foundation, we believe America can become a nation where getting healthy, staying healthy, and making sure that our children grow up healthy are top priorities. Where the health of everyone matters, no matter where they live, where they come from, or how much money they have. We have a vision of an America where we all strive together to build a national culture of health. A culture that enables all in our diverse society to lead healthy lives now and for generations to come. And we are committed to working with you to get us there together. What does a culture of health mean to you? It might mean high-quality healthcare that's affordable and actually gives you what you need, where and when you need it. It might mean knowing that your kids will be safe walking to school, and once they get there, they'll learn how to grow up safe and healthy. A culture of health might mean working for an employer who makes it easy to make healthy choices for you and your family. Knowing that there's a store nearby where you can find fresh, healthy food for sale, especially if your neighborhood has never had a place like that before. It might mean that your mayor keeps your health in mind when making decisions about housing and streets and transportation, and that we all look out for each other every day. We believe a culture of health is all of these things, and if America is going to get there, we need to work together to achieve it. There's an African proverb that teaches it takes many hands to cover the sky. And it will take all of us working hand in hand to identify and support the positive changes that are already happening in towns and cities across America. We need to spread the lessons of successful programs and build a movement towards health that is fueled by every one of us, families and businesses, individuals and communities, schools, faith-based organizations, and our government. At the Robert Wood Johnson Foundation, we've decided to make building a culture of health the central aim of everything we do. It will enhance our work on issues like childhood obesity, healthcare coverage, and the cost and value of care. And it will propel us to reach out to individuals to pursue new partnerships, especially with business, to build a dynamic network of health leaders to meet the demands of the 21st century, to widen our focus on preventing violence, and to work to ensure that everyone in America has an equal opportunity to pursue good health. Transforming our nation will take time. It'll take collaboration, and it won't be easy. But I am convinced that if we all come together and channel our energy, nothing will stop us from building a strong and lasting culture of health, the kind that we all deserve. Because this is our country, our future, our lives. Let's work together to make them as healthy as they can be.
Good morning. My name is Denise Rogers, and I chair the Believe in a Healthy Newark Initiative Steering Committee. And it is my pleasure to welcome you to what we hope will be the first annual Building a Culture of Health in Newark conference, sponsored by the Believe in a Healthy Newark Initiative. The Believe in a Healthy Newark Steering Committee has been planning this conference for many months. And I'd like to start by asking my fellow steering committee members to stand up so that we can thank them for all of their hard work and efforts to make this day possible. I'd also like to acknowledge Beth Milton, who's at the back of the room, who is the project coordinator for Believe in a Healthy Newark. She is the glue that kept all of this going, and quite frankly, Without her, we really would not be here today. Throughout the day, you're going to see several people walking around with name badges that identify them as volunteers. I'd like to thank all of them as well, and I'd like to urge you, as you're walking around today, to thank them on our behalf. Finally, I'd like to thank our financial sponsors. Without their generosity, this conference would have never come to fruition. In addition to support, of course, from the New Jersey Health Initiatives, I want to thank the Greater Newark Healthcare Coalition, the Greater Newark LISC, the Nicholson Foundation, New Jersey Partnership for Kids, Rutgers Biomedical and Health Sciences, RWJ Barnabas Health Systems, University Hospital, the United Way of Essex and West Hudson, the Urban League of Essex County, and the YMCA of Newark and vicinity. Thank you all for your support. As you may know, the Believe in a Healthy Newark initiative was launched in 2015 with grant funding from New Jersey Health Initiatives. They're building a culture of health in New Jersey, Communities Moving to Action program. After our first year of planning, the Believe in a Healthy Newark Steering Committee decided to create 3 impact teams focusing on 3 content areas in 2 wards of the city. We created the Food and Fitness Impact Team, the Healthy Homes Impact Team, and the Adverse Childhood Experiences Impact Team to develop projects focused on the South and West wards of Newark. We decided that our efforts were more likely to be impactful if we focused on a subpopulation of the city, and most of the organizations represented on the steering committee were already doing work in these 2 wards. Today, you will learn more about our work. Our long-term goals are to develop additional partnerships that will allow us to expand our work beyond the South and West wards. We might also want to expand the number of impact teams working in the city. It's important for me to emphasize that our main agenda is to address the social determinants of health, factors like education, income, employment, access to care, and the neighborhood you live in and the safety of that neighborhood. We now understand that these factors account for about 40% of an individual's health outcomes, compared to 20% of outcomes being determined by clinical care, the kind of care you usually get in healthcare settings. 30% of outcomes are related to personal behaviors, what we eat, how much we exercise, what substances we put into our bodies. And the final 10% of outcomes are related to the physical environment in which people live. To bring our work to life, I'd now like to tell you the story of Anaya Robinson, an 8-year-old African-American girl who lives at 216 South 11th Street in the Fairmount section of the West Ward. Anaya is a 2nd grader in the 13th Avenue School, having been held back in the 1st grade because of poor school performance due in part to multiple sick days. It's going to be hard to read. Okay, thank you. You see, Anaya has poorly controlled asthma with frequent exacerbations that result in multiple visits to the emergency room, and she's had 3 hospital admissions in the last 2 years. When Anaya was 2, she was found to have significantly elevated blood lead levels, and an inspection of her house showed peeling lead paint in most of the rooms. Remediation of her house resulted in Anaya and her family being placed in temporary housing for nearly 6 months. During that time, Anaya's parents split up, and her mother began to exhibit symptoms of severe depression. At times, Anaya's mother would drink in order to treat her depression, and unfortunately, at times when she was drunk, she would become both verbally and physically abusive to Anaya and her older brother, John. Like many children in Newark, Anaya is very overweight. One contributor to her weight is the prednisone that she frequently has to take to treat her asthma. Another is the diet that consists of a lot of fast and processed foods. 3 blocks from Anaya's house at the intersection of West Market and Bergen Streets are McDonald's, Wendy's, and Checkers fast food restaurants. While the new ShopRite in Newark is only a mile away, Anaya's mother doesn't have a car, so she does most of her shopping at the H&Y corner store located at the corner of 11th Street and 12th Avenue. Fortunately, Anaya has health insurance through Medicaid, so all of her doctor visits, ER visits, hospitalizations, and medications are paid for. However, due to her mother's mental illness, the family often struggles to make ends meet, and several times they've been at risk of eviction because her mother couldn't pay the rent on time. It should be noted that through the efforts of the Fairmont Neighborhood Association in collaboration with the Urban League, Kaboom Park was developed on a corner lot not too far from Anaya's house. However, every time her mother or teachers or healthcare providers encouraged her to go play in the park, Anaya refused, saying that she was afraid. Everyone assumed that she was afraid of being a victim of violence. However, during a visit with her primary care provider, Anaya confessed that she's afraid to go to the park because she's afraid of having an asthma attack while there, and that no one will be able to help her. You see, last summer, Anaya had a really bad asthma attack during one of those really poor air quality days, and that attack resulted in her being admitted to the pediatric intensive care unit for 2 days. For the first time, Anaya realized that she actually might die from this asthma, but she was afraid to tell her mother about this fear. If we think about Anaya's life holistically, we realize that she has suffered at least 4 adverse childhood experiences. She's been abused verbally and physically by her mother. She lives with a severely depressed parent. She endured the separation of her parents, and she had a near-death experience due to her asthma. The American Academy of Pediatrics has also made clear that living in poverty in the United States is an adverse childhood experience in and of itself. Research done by the Safer Newark Council indicates that there are several hotspots of violence in or near the Fairmont section of the West Ward. This significantly increases the likelihood that Anaya will be either a witness to or a victim of violence. Therefore, Anaya, in fact, has suffered 5 and possibly 6 ACEs. Research tells us that if Anaya has 6 or more adverse childhood experiences, she is at risk of having a life expectancy that is 20 years less than the overall life expectancy for women in the United States. There are other things that might contribute to Anaya being sicker and dying younger than her more affluent and white counterparts. For example, research tells us that if she drops out of high school, her life expectancy will be 8 years less than the life expectancy of a woman who graduates from college. The educational attainment gap is 9 years for men. Anaya's zip code is also a predictor of her life expectancy. Research funded by the Robert Wood Johnson Foundation at the Virginia Commonwealth University Center on Society and Health has looked at life expectancy by zip code. While they've not looked specifically at Newark, their work has demonstrated a 14-year life expectancy gap between babies born in Trenton, who have a life expectancy of 73 years, and babies born in Princeton, who have a life expectancy of 87 years. I would predict that similar gaps exist when comparing life expectancy for a baby living in Essex Fells when compared to a baby living in Newark here in Essex County. Some of you listening this morning will be annoyed at my seeming exaggeration of this child's adverse life circumstance. However, many of you know the Anayas of Newark and their families, and you know there is no exaggeration here. Anaya Robinson is a name I made up for the purposes of this talk, and her address doesn't exist. However, everything else I've described is true. Langston Hughes wrote, "What happens to a dream deferred? Does it dry up like a raisin in the sun, or fester like a sore and then run? Does it stink like rotten meat, or crust and sugar over like a syrupy sweet? Maybe it just sags like a heavy load, or does it explode? Today, we are here to remind ourselves that it is reasonable to dream about universal access to health care in America. Today, we are here to remind ourselves that it is reasonable to dream that universal access will include access to high-quality mental health and substance abuse services. We are here to remind ourselves that it is reasonable to dream of the elimination of health disparities by race, ethnicity, and socioeconomic status. We are here today to remind ourselves that it is reasonable to dream of an end to poverty, to dream of a country where everyone has enough to eat with easy access to healthy foods. We dream of an end to homelessness and an end to violence in our neighborhoods. It is reasonable that we dream of a place where all children get a good education and where everyone who wants to work has a job. As Risa Levizo-Morey said in the opening video, we dream and work for a city and a country and indeed a world where our children grow up healthy, where the health of everyone matters, and where we all look out for each other. Together, we strive to build a culture of health not only in Newark, but in every town and city and county in this country. And with all of us in this room working together, hand in hand, supporting each other, we need to understand that our dream doesn't have to be too much longer deferred. Thank you. So it now gives me great pleasure to introduce the moderator of our next panel, Jen Velez, who is also a member of our steering committee, who is the Senior Vice President for Community and Behavioral Health at the RWJ Barnabas Health System, and the former Commissioner of Human Services for the state of New Jersey. Jen and your panel, welcome.
It really is a distinct pleasure to be with all of you this morning. And I just want to take a moment to acknowledge Dr. Rogers, who is incredibly modest in her accomplishments and commitment to this city. It's really been a pleasure, and I would say an honor for me to call Denise a friend over these many, many years, I think 25-ish or so. But her commitment to this city it's just been extraordinary, and I think the word that really comes to mind is it's been sustained. So up and down, you know, hard and easy. I'm not sure where the easy part was, but even during the time where our city needed an interim health director, Denise stepped in. So you have but a brief mention of her bio in our program, but suffice to say that merely scratches the surface, truly, of Dr. Rogers' commitment to this city and her leadership to this effort. So it really, I just, if you would please acknowledge Denise with me. A number of roles. It would take me the hour to talk about Denise, so I won't do that. I do want to set a little bit of context, though, interesting to me. So 50 years ago, our great city experienced the Newark riots. And that was a really violent and tumultuous time for the city. And out of the Newark riots came the Newark Agreements, which is a document that memorializes what Newark wanted post the riots: economic development, workforce development, commitment to a healthier city. They were never, the agreements were never codified anywhere, meaning in legislation. And many of you are probably familiar with them, but they're tough to find. I have a typed up copy in my office. But the one phrase that's in there, and I hope I'm quoting this right, in the agreements it says, "A new era of community health screams to be born." So following Denise's screaming earlier, and I hope we scream throughout the day, that's really why we're here. A new era of community health screams to be born. So that was 50 years ago, and here we are, 2017, and our healthcare outcomes in our city, as Dr. Rogers just alluded to in that story, are no better today. We all own that. So I do hope that today really we're hoping to bring to you and with you some solutions in that space. So we're really fortunate to have this opportunity in our city, and I can't thank the foundations enough for your support. We realized very early on that building a culture of health is something that we can't put on top of a city. We need to really understand what's the existing culture and history, like I just alluded to. What is our existing culture and history today? What's geographic, temporal, cultural, what makes up this great city of ours? We have to address the health of the city as a whole and recognize the city as this living and breathing organism, really, with a pulse of its own. And that fluctuates with the city's economic vitality, the health of its residents, and the well-being of the very diverse communities that make up our city. So Newark has experienced a lot of economic decline. It's really taken a toll. And when you scan the city, you'd pick up some of those symptoms, right? You've got some areas of still very dilapidated environments, limited food access, poor health. But the vitals check, you'd find a strong pulse. So when we began this initiative in 2015, that's what we really tried to do. Take the pulse of the work, the great work that so many of you have already done and continue to do, thankfully, in this city. And we realized that there are so many organizations that are working to address those symptoms. So housing, employment, nutrition, exercise, healthcare. So we've really got to collaborate and couple that work together so we can have a much greater collective impact. So, as was mentioned, we've got 3 impact teams, and this is really the time during the conference before the breakout sessions where you will be able to hear a bit of a deep dive into those impact teams' work. And then as the day goes on, you'll select a panel to attend and hopefully participate very robustly in. But this is where you'll hear the work of the entire initiative presented to you. So, and hopefully we'll have some time for some Q&A. Now, this is also a multimedia portion of our show, and you've got the least capable person leading you through that. So, I'm going to start with our first impact team. Thank you, Ryan, who's my technical assistant. Rhonda Lewis, I will call up to the podium first. Rhonda is the Executive Director of Greater Newark LISC, which is a strong partner in revitalizing Newark's neighborhoods for the past over 20 years now. So Rhonda will take you through the first impact team, which is Healthy Homes. Just going to start with the PowerPoint.
I'm ready. Good morning, everyone.
Good morning.
The Healthy Home Impact Team is focused on promoting healthy homes. A healthy home supports the well-being of people living there and is free of toxics, namely asthma triggers and lead poisoning. Can you hear me? Sorry if I moved away. Those are the 2 areas that we're working on now, but we also know that in the future we'll be focusing on mold and air quality, but these are the first 2. And right now, we are focused in 2 neighborhoods, like Denise said, the Fairmont Heights and Clinton Hill neighborhoods of Newark. We work through school and childcare centers and health providers to connect with families to raise awareness about early detection and prevention, provide families with resources, and help them connect with available services. Ultimately, our collective impact focus is to identify, using the data and voices of our families, policies that will influence long-term deep and scalable impact. I want to shine a spotlight on Cleveland in the next video to give you a sense of the difference we are making here in Newark.
When we have to hospitalize a child with asthma, we take that as a failure in medical care.
Housing is really the platform to push health forward. We can't do it alone. Health is important, housing is important, but putting those two together is a dynamic that can really push forth the health agenda.
The home is their refuge. It's the place where they need to be safe and healthy. And so whatever we can do in that regard is what matters the most.
I think the promise of health philanthropy in part is to be concerned about health before care, and that's primary prevention work. And so when we think about prevention in the inner city, in the urban community, we think about problems in the environment that are substandard.
Too many people, particularly kids, live in housing that is unhealthy.
When our community is not physically healthy, we're not really doing our jobs as pastors. To remind them of this calling is our goal.
Addressing healthy homes is going to save money to the system, it's going to improve the health of the residents in the community, and it's going to maximize the benefits and the economic futures for all these families.
The Healthy Homes Advisory Council of Greater Cleveland is a collection of well over 70 agencies who collaborate to improve the quality of life in Cleveland and also to reduce the health care costs that exist within Greater Cleveland.
When we look at the numbers of substandard housing in the United States, we've done some research that shows that there's probably 26 million substandard housing units in the United States. Well, that can mean that there are a lot of homes out there that have lead-based paint, got lead dust in the yards, got mold problems, moisture problems, on and on. And so to deal with those houses, we need to find ways to ameliorate the conditions.
Things in the Cleveland area that are making people ill in their homes are many, and it takes a detailed examination of their home to sort out exactly what the concerns are, usually done in the context of what their health concerns are also. But a listing of things would include dust, clutter, combustible gases coming off of a cooking stove, water intrusion and mold growth, whether it's visible or not. And of course, we're always concerned about the lead dust that comes particularly from windows in older homes that have had lead painting in the windowsill.
We began to learn over time that the house is really a system. And what you do at one point or another affects something else. And transport of pollutants is a major problem. And how we deal with the house as a system can affect that.
The house is an important part of what makes a healthy community. And of course, we've all heard that place matters, and certainly the house within that place is an important part. The relationship between health and housing is profound, and there's been many smart people that have talked about that relationship, and that the health of the house really impacts the health of the occupants. And so by improving housing, making it affordable, safe, healthy, and green, we can hopefully improve the health outcome of those folks living in the house.
If you have a rather severe course of asthma as a young child, that affects your lungs for the rest of your life and can be a predisposing factor for producing chronic lung disease when you're an elderly person.
Well, my son, he's had asthma since he was like 6 months old. He was diagnosed at 6 months. So from the time he was 6 months to say 17, he would sometimes have to go to the hospital, or we would need a emergency inhaler, things like that. So it went on for a while. And I just think that since we've got these improvements to my home, that he's not having as many issues as he was having before. I'm a working mom and I don't make a lot of money. So when they came in and put the installation in and did the different things to the outside, the inside, that helped me, so I'm able to help my home.
In the short term, what we're really looking for is to improve housing and improve health outcomes. And many of our clients will report that their kids are no longer missing as many days at school. They don't have to take off work. They can make sure they go to their job and make money, and their kids can get all the education that they need.
Many people don't think about it until they have a health problem. So that makes it more difficult to get a systemic change going, because you spend so much time dealing with individual cases that it's hard to get a systemic change. So I'd say the biggest challenge to healthy housing is raising the level of consciousness so that people are aware of how important it is for everybody, whether you are personally now at this time experiencing a health condition related to it.
As you can see, the Cleveland story is the Newark story. And that's why we are proud to coordinate the work of the Believe in Healthy Newark Healthy Homes Impact Team. We understand the importance of a healthy home that addresses the high prevalence of childhood asthma and the alarming rates of lead exposure in our community. Children spend over 90% of their time indoors, whether it's at home or school. Both contain health hazards associated with asthma and lead. And as you know, even low levels of lead exposure can lead to low IQs, hyperactivity, and behavioral problems. About twice as many children in Newark have asthma than in the surrounding county, and asthma is the leading cause of absenteeism for children pre-K through third grade. The Healthy Home is a broad cross-sector of stakeholders focused on chronic asthma and lead. And my co-chair in this is Stephanie Greenwood from the Victoria Foundation, and some of our partners include the City of Newark, R.W.J. Barnabas, Rutgers School of Nursing and Public Health, the Urban League, Victoria Foundation, CAPC, and the Housing Community Development Network, to name a few. In the short period of time that we've been working, we've raised roughly $120,000 to do this work, and we are partnering with La Casa de Don Pedro to conduct remediation of weatherization for 40 families in our targeted neighborhood. We provide case management for children with elevated lead levels of 3 or more, and we distribute household cleaning kits and other items, along with educating and providing case management to the families. So I have more, but I think Jen's gonna give me the boot, so. Grace, I have 2 minutes. But thank you, and I hope that you will visit one of our 2 impact teams. One is on asthma, and one is on lead, and I think you will find a lot more information and ask a lot of questions. So thank you.
One thing I just wanted to clarify for everyone, when we started this effort, it wasn't prescriptive. It wasn't, you need to do something around homes and food and fitness and adverse childhood experiences. We gave this a tremendous amount of thought, and for all the type A personalities that we are, it was a little challenging because we were trying to figure out the exact approach. What should we be doing? And really to take the pulse of what is happening and what can help define a culture in the city is, I hope, what at the end of this conference you see that that's where we landed, I think, are the right areas of focus for our impact teams. So thank you, Rhonda. It clearly takes a village to change the village, and I think the impact team work in this area is, as everyone here knows, critically important, but as Dr. Rogers said earlier, it is reasonable that our kids grow up in homes that are healthy and in neighborhoods that are healthy and safe. So that's important work. Thank you very, very much. Next, in our second impact team is food and fitness. And Catherine Wilson is the president and CEO of the United Way of Essex and Hudson. And their mission is to really fight for the health, education, and financial stability of every person in the communities in which they work. So, Catherine, if you could join us at the podium.
All right. Well, good morning. So the goal of the Food and Fitness Committee is to really address the lack of access to fresh foods, nutritional education, and access to exercise and safe spaces for recreation within the south and the westwards of Newark that we've been targeted. So we have members from community development corporations, we have representatives from RWJ Barnabas, community development leaders, education, and child care providers. And I'm going to put a shameless plug here and say if anybody wants to join our committee, we're accepting new members as well. So through some collaboration, some brainstorming sessions, we developed a set of goals and indicators of success for the food and fitness team to really make an impact in the community. So anybody knows me knows that I always start with the data. I'm a big data geek. So when we talk about food and fitness, we're talking about childhood obesity and food insecurity. So I want to give you a little bit of background and data on why we chose the goals that we chose. So over 30,000 children in our city receive SNAP. Over 12,000 women and infants receive WIC. Over 28,000 students are eligible for free or reduced price lunch. That's 80% of all Newark students. And that's both traditional and charter. So 45% of our female students and 43% of our male students are obese or overweight. Only 19% eat vegetables 3 or more times a day. So that means that 81% of our kids don't. 48% don't eat fruits and vegetables as snacks every day, which means they're eating something else, sugary drinks, sugary snacks, salty snacks. They can get them very easily and cheaply at the corner store and bodega. 20% consume fast food 2 or more times a week. So you heard Dr. Rogers say this morning that within less than a mile of Anaya's home, there were 3 fast food restaurants. And I actually found out last week that McDonald's now delivers, which makes this even more harrowing and awful. So within those horrible statistics, there's a sort of deeper dive of the environment in which our kids live. So the percentage of those kids who don't have a large selection of good quality fresh fruits and vegetables or low-fat foods at their main food store, there's 36% that don't have the access to fresh fruits and vegetables, 47% don't have access to low-fat foods. The percentage who say that cost is a barrier, so this is parents, aunts, uncles, grandparents saying that cost is the barrier to why they don't have fruits and vegetables, low-fat foods, 40% to 49%. Now, this data is from 2010, and in the data world, that's fairly old, but I would surmise to say that this data hasn't really changed that much, and I see Jeffrey Backstrand nodding at me, so I know that's true. And the really alarming piece here is that 25% of all Newarkers report that they often, sometimes or often, do not have enough food to eat. And so I think what's really troubling here is that we have a large percent of our students who are obese or overweight, but who are also food insecure. So that's a big issue. Again, recreation. 54% of our students are not active 30 minutes or more a day. 48% never walk, bike, or skate to school. We can surmise that this is because they're afraid. Some of the neighborhoods are not safe to walk to school. There's been shootings outside of schools. There's been shootings in neighborhoods. 48% get activity 2 or fewer days a week at school, so they're not having recreation. Maybe they're not having gym class as much. That is also an issue. Okay, so all these terrible things are happening around obesity, access to food, nutrition, and so the Food and Fitness Committee came up with 3 goals. So the first goal is obviously provide access to affordable, healthy foods, including urban farms, community gardens, and farmers markets. So if you've worked or lived in Newark for a while, you've been noticing there's these farmers markets and urban gardens that have sort of been popping up. But nobody really knows like exactly where they all are. And so we will be publishing a map and advertising with local entities for families to have access to where those low-cost fruits, vegetables, healthy foods are. We're also thinking about doing it on the city website because they've been pushing out a lot of technology for people to go and get information. So we're going to try to be working with the city on that as well. And then explore creating a farmer co-op for SNAP, creating a system of payment that allows families to access those community gardens, urban farms, and farmers markets. So there's some sort of obscure legislation that says you can't use SNAP at certain farmers markets and urban gardens if they don't have a co-op. And so we're looking to figure out how do we sort of change that. Okay, the second goal is adopt a food policy that includes all children deserve high-quality food. So we want to really conduct a campaign around access to healthy food for children. I'm sure you've all seen it, the statistics and what the government considers to be a vegetable that's served at breakfast and lunch. A lot of our kids, as I said, get free or reduced breakfast and lunch every single day at school, but the food that they're being served is not always the highest quality, it's not always the most nutritious. So we're looking at having the Newark Municipal Council adopt a local nutritional standard for preschools, meals served in community service organizations, and schools. This is a huge undertaking. This is not going to happen in a year. So don't come back to me next year and say, how you doing on that? It's going to be a while. But we want to make sure that we adopt those nutrition standards because if we're asking parents to have a standard for their child, we certainly should be asking the school and where they get the majority of their meals to have those standards as well. And then the third goal is really around physical recreation and activities, mapping physical recreation locations, not limited to parks and playgrounds, but also where can kids go to have access to regular recreation and safe spaces, hoping to reduce the childhood obesity rates within the city. So why these goals? Why did we pick these goals? Obviously, childhood obesity in our city and in our country is an epidemic. It leads to increased rates of chronic diseases later on. And the key to reducing childhood obesity is really increasing physical activity and improving nutrition. So that's why we chose that. And the policy interventions are really when you have a policy intervention, that creates a different environment and that creates different behaviors. So that's what we're really looking to do to achieve the greatest benefit. So I have a really short video. I'm going to cue this up for you. This is Sam Cass. He was President Obama's food policy advisor. He's also a chef. So he's talking a little bit about being a judge on a cooking show with school lunch ladies. So he's going to talk, he talks a little bit about that, but then he goes in and this particular segment, I encourage you to watch this if you've never seen this. He's going to talk a little bit about how having healthy nutrition impacts a child.
And we're going to focus on the most important meal of the day, breakfast. Meet Allison. She's 12 years old, she's smart as a whip, and she wants to be a physicist when she grows up. If Allison goes to a school that serves a nutritious breakfast to all of their kids, here's what's going to follow. Her chances of getting a nutritious meal, one with fruit and milk, one in lower in sugar and salt, dramatically increase. Allison will have a lower rate of obesity than the average kid. She'll have to visit the nurse less. She'll have lower levels of anxiety and depression. She'll have better behavior. She'll have better attendance, and she'll show up on time more often. Why? Well, because there's a good meal waiting for her at school. Overall, Allison is in much better health than the average school kid. So what about that kid who doesn't have a nutritious breakfast waiting for him? Well, meet Tommy. He's also 12. He's a wonderful kid. He wants to be a doctor. By the time Tommy's in kindergarten, he's already underperforming in math. By the time he's in 3rd grade, he's got lower math and reading scores. By the time he's 11, it's more likely that Tommy will have to have repeated a grade. Research shows that kids who do not have consistent nourishment, particularly at breakfast, have poor cognitive function overall. So how widespread is this problem? Well, unfortunately, it's pervasive. Let me give you two stats that seem like they're on opposite ends of the issue, but are actually two sides of the same coin. On the one hand, 1 in 6 Americans are food insecure, including 16 million children, almost 20%, are food insecure. In this city alone, in New York City, 474,000 kids under the age of 18 face hunger every year. It's crazy. On the other hand, diet and nutrition is the #1 cause of preventable death and disease in this country by far. And fully 1/3 of the kids that we've been talking about tonight are on track to have diabetes in their lifetime. Now, what's hard to put together, but is true, is that many times these are the same children. So they fill up on the unhealthy and cheap calories that surround them in their communities and that their families can afford. But then by the end of the month, food stamps run out, or hours get cut at work, and they don't have the money to cover the basic costs of food. But we should be able to solve this problem, right?
Thank you.
Thank you, Catherine. That issue of food and fitness is, not to state the obvious, but it's complicated because there are really embedded economic interests that can work against the goal. There are businesses that rely upon now the delivering of McDonald's. I didn't know that. So these are not easy solutions, which is why, again, I go back to my screaming that I mentioned earlier. It really does scream for a solution. I would dare say, without getting political, that former First Lady Michelle Obama's focus on this issue, intentional focus on this issue, did so much for so many to really elevate the awareness of the need for healthy food, fitness, let's move, in ways that really I would dare say had not been done before on a national level. So I think this is the impact team that wants to continue to take up that mantle and the good work there. My shameless plug is that Newark Beth proudly has a greenhouse and accepts the SNAP benefit. I'm so psyched about that. I'm so proud of Newark Beth. And while I'm proud, I will also say that's what we should be doing, and we are, so I'm glad about that. So more complicated than I think the title might suggest, food and fitness, that we just eat healthier and move a little bit more and we'll be good to go. It's working through some of those deeply embedded interests that might be counter to the ultimate goal. So you've heard from two so far. Next, our next impact team is led by Carrie Lugoso, who is the Executive Director of the Greater Newark Healthcare Coalition, and I would say someone else too who has a deep history in our city in terms of sustained commitment. Former Executive Director of Winona's House, former colleague at the Office of the Child Advocate, and a leader, I would say, in Newark as well. And this impact team's area of focus is adverse childhood experience and resilience. Very interesting work, somewhat groundbreaking, getting a lot of attention as of late, and I think Carrie has developed some expertise in this area that you'll really benefit from hearing from today. So welcome, Carrie.
I'm not so well, we have to just get the video up. So, good morning, everyone. Humbled and grateful to be here. And my strategy at first was to find a few people I could focus on as I'm doing my remarks. And then I realized this whole room is full of loved ones and friends, new and old. So that makes it very easy, relatively. I thought it would be helpful as we discuss the ACE Impact and Resiliency team to frame the issue of ACEs with a brief video.
What does your parents' divorce have to do with your risk for heart disease? If your mother had a drinking problem when you were growing up, are you more likely to suffer from depression as an adult? Here's what you should know about ACEs. ACEs stand for Adverse Childhood Experiences, extremely stressful events that can happen to a child growing up. Some experiences are so stressful that they can alter brain development, as well as the immune system, increasing the risk of lifelong health and social problems in adulthood. The term comes from the Adverse Childhood Experiences Study, landmark research that shed new light on the root cause of everything from stroke and liver disease to substance abuse and mental illness. In the late 1990s, an epidemiologist from the Centers for Disease Control and a preventive medicine doctor at Kaiser Permanente set out to understand the association between childhood experience and lifelong health. They asked over 17,000 people in the Kaiser Health Plan in San Diego about their health history, as well as difficult questions about their experiences growing up. Anda and Felidi tallied up 10 different kinds of adversity in this largely middle-class and college-educated population. They were stunned to see how common ACEs were. 21% of all respondents were sexually abused as children. 19% grew up with someone who suffered mental illness. 28% had been physically abused. And 2 out of 3 respondents had experienced at least one ACE. The researchers next looked at how someone's ACE score, or the number of adversities they experienced, related to a wide array of serious health and social problems. They saw that the more ACEs someone had, the greater their risk for poor outcomes compared with someone with no ACEs. Someone with an ACE score of 4 had twice the risk of heart disease and cancer. Someone with an ACE score of 5 had an 8 times greater chance of being an alcoholic. And those with an ACE score of 6 or more, on average, died 20 years earlier. With every major problem they looked at in the ACE study, the risk went up for each additional adverse experience in childhood. As Dr. Robert Anda says, what's predictable is preventable. It's important to remember that ACEs are not destiny. ACEs are a tool for understanding the health of a population as a whole. For individuals, an ACE score can be a tool for understanding their own risk for health and social problems and empower them to make changes for themselves and their children. ACEs tend to get passed down from generation to generation and are common across all income levels, races, and cultures. But increasingly, people of all different professions and backgrounds are coming together to discuss how ACEs affect their communities. They're finding new ways to treat and prevent ACEs. Many doctors are starting to screen their patients for ACEs as part of their medical history. More schools are becoming trauma-informed, considering the source of problem behavior when disciplining their students, instead of immediately suspending or expelling them. To learn more about interrupting the cycle of adversity and improving health and well-being for the next generation, please visit kpjrfilms.co.
Thank you, everyone. Hopefully that was helpful in framing adverse childhood experiences as we get started talking about the impact team. So here in Newark, the ACE Impact Team is a network of over 80 individuals from a wide cross-section of backgrounds. So pediatrics, behavioral health, education, law, philanthropy, the faith-based community, community advocacy, and the list goes on, coming together to work towards creating a trauma-informed community. And in this past year, we started meeting, I should say, in August 2016, and we learned that we had a lot to learn. So that was an early lesson that we were committed to doing together. And we brought in Dr. Sandra Bloom from Drexel University. She is the founder of the Sanctuary Model and internationally recognized as a mother of sorts of disseminating this work around the globe. And we were able to do that, I should also say, with the support of the Centers for Healthcare Strategies here in New Jersey. Newark is one of 6 communities around the country that is part of an initiative to advance the adoption of trauma-informed approaches to healthcare specifically, but as we're all here to do today, conceptualize healthcare more broadly than we had traditionally done. So coming together, we made a commitment to being socially conscious, acknowledging the cumulative intergenerational impact of stressful experiences and environments, and to understanding and accounting for the historical forces, we heard about some of those earlier this morning, that have left a legacy of racism and segregation in our community, as well as structural and institutional factors that perpetuate inequity. We're committed to recognizing the role of privilege in contributing to inequity in health outcomes. Regarding the depth and breadth of the impact team, we also are committed to encouraging meaningful public participation, so that's a perfect opportunity to give a similar shameless plug for the impact team as my dear colleague Catherine did for hers. You can join more than one, so sign up for as many as you'd like and tell all of your friends, because we want this to be everyone's effort. Right. We are committed to recognizing the cumulative impact of multiple stressors and focusing on changing community determinants. This is part of the dialogue about shifting conversations to what's wrong with you, to what happened to you, and what's happening to you in your daily life so that we can optimize people's health and well-being. Strengthening the social fabrics of neighborhoods is one of our goals. Promoting equity solutions and addressing the developmental needs of all age groups. ACEs and resiliency are most definitely an example of a 2-generation approach, because we tend to talk about children and preventing and intervening early in children's lives, and we know children live with caregivers. So it's equally important to understand the health and the history of the caregiver who is raising the child in their day-to-day life. The priorities we've identified in our first year for systemic change there are 4, and there are 3 work groups that are coming from each of these. So I'll just walk you through those and then talk a little bit about the 4th. So one of our work groups that's emerged in this past year has a goal of educating the community about ACEs, trauma, and resilience. So that's our community awareness and education work. Our second area of work is about understanding the practical interventions presently in practice in Newark to address childhood adversity and trauma. We want to understand the current landscape of services better so that we avoid some of the pitfalls of duplicating effort or of innocently avoiding or not helping where there are gaps in service delivery. Third, we need to prepare the workforce across sectors with the information and skills needed to incorporate trauma-informed practices into that work. And I would ask that you think of that. When I say workforce, it's probably too narrow of a word, because it means everything from our faith-based community. There's a way of delivering ACEs science and information from the pulpit. There are ways of doing it in the classroom, in the primary care setting, in the community when you're in the mentoring space, and so on down the line. I mentioned the home already, but really on this side, it's more about who interacts with our children and families and how can we help them do the best job that we know they want to do to optimize child and family health and well-being. And the last item on this slide is not a distinct work group, and that was part of our learning this year. Is that rather than having a separate data research evaluation work group as a standalone, we are committed to embedding the use of data to support policy and practice changes across the 3 work groups. So I want to just give you highlights of 2 current projects. One is a youth healing team. This is a pilot with 8 Malcolm X Shabazz students who will be engaged in a 10-month ACEs and resiliency curriculum to better understand the brain science of ACEs. And they will receive stipends during this academic year to acknowledge the time and commitment that they're taking in this regard. They're going to learn the neuroscience of ACEs and resiliency, discuss adversity and trauma, and then translate their learnings into the best way to message it to their peers and to the rest of the community. So they become our health ambassadors. We're testing this out. And this work is being carried out in conjunction with Leaders for Life, a mentoring organization started by Al Tariq White, who is a proud graduate and was a teacher and has been a coach at Shabazz. My Brother's Keeper is another critical partner in the work, and it's funded by a Robert Wood Johnson Action Accelerator grant. The other project I want to highlight is Undoing Racism training. This is a 3-day training facilitated by People's Institute for Survival and Beyond, and has as its local implementation leads Fatima Muhammad of Equal Justice USA and Katim Shearer El of Results Driven Consulting. The training focuses on understanding what racism is, where it comes from, how it functions, why it persists, and how it can be undone. The training will consist of individuals representing law enforcement, healthcare, education, community advocates, youth, and faith-based leaders, and it's funded by the Schumann Fund. And we're in the planning stages of that with a December 6th through the 8th training commitment. We've secured our national trainers, and we're working on that really exciting opportunity together. And as I wrap up, I want to draw your attention to what I find to be a helpful infographic. I hope it is for you as well. It's from the Prevention Institute, and it's part of a great document that they have about resilient communities. So this is the full infographic that shows the interplay between individual approaches and community strategies and building a resilient community. Just because of the size of the room, we broke it up into 2 halves. So at the top half, you can see that the individual approaches include trauma-informed care in the life of the individual, mental health services. Community strategies are 3-part: equitable opportunities, people-based strategies, and place-based strategies. And you heard my colleagues talk about safe environments, safe corridors. They're all interconnected into many facets of healthcare. And these strategies need to work together so that we have reduced individual and community trauma and a reduced risk of violence and threats of violence. And then you see a bidirectional relationship with the lower half of the infographic, which is the goal, which is a resilient community, which we are committed to being a part of for Newark, which has equitable opportunity, which has strong social networks and other supports for people. And the place-based strategies include the safe open spaces, parks, ways that people can exercise and be active. They're engaged in the arts. They perceive their community as safe. They have available food and other products in their daily lives, and they have quality housing. And the goal, the overarching goal that we're all rowing towards, is increased well-being for individuals, family, and communities. So thank you for listening. I look forward to the rest of the day.
I do hope you enjoyed that last segment as well. That is a holistic approach, but it's a very, very intentional approach. And I think when we talk about Newark becoming a trauma-informed city, this is the work that's going to get us to that place. This is the work that will help us achieve that goal. Off topic just a second, I wanted to say, so Saturday night, I was at NJPAC for its 20th anniversary. Some of you may have been there, I don't know. That was an extraordinary night. There was a lot of celebration with a lot of leaders who 20 years ago did not imagine for a nanosecond that they would be sitting in one of the most extraordinary halls in the country, I would say. And there was a lot of talk about reminiscing about the fact that there was so much adversity working against those efforts to just imagine that this could be possible, that world-renowned talent would come to Newark and that people would attend. And the room was packed, and it's been packed, and they support the arts for our kids, and they support the arts for our city and well beyond. And I just want to mention that as when the dream was there for the arts in the city 20 years ago, it took a group of leaders, many, many leaders and funders and believers and dreamers to get NJPAC to its place today. So I think, and I think part of why we're here today and hopefully engaging with so many of you who are leaders already in our city to come together in this collective impact approach that we're imploring you to join and join with us in this effort to close your eyes and believe in and imagine a day that Dr. Rogers described earlier, that it is reasonable that we could have a culture of health in our city for our kids and for our families. So that's part of what why you're all brought here today. We hope you find it informative and helpful. And I think we probably have a couple of minutes before a short break. If we have any questions for any of our impact team leaders, we could probably take a couple. Any 10 minutes, okay. Do we have any questions for our impact team leaders, either on healthy homes, food and fitness, or trauma-informed care, the ACEs work that Kerry described? Marcia?
Please use a microphone.
Thank you. I had a question for Catherine about the data that she was presenting, and I just wanted to make sure that it accounted for other factors that led to poor health or school attendance. You were talking about how unhealthy homes impact kids' health and people, right? Am I getting this right? Pardon me? Yes. Okay. So can you talk about other factors that may come into play and whether those were accounted for?
Sorry. In terms of, there's data that I didn't present around who has access to healthy food in their neighborhood, whether or not they have a grocery store, whether or not that grocery store carries fresh fruits and vegetables. Like I said, a lot of folks are visiting the bodega and the corner store, but also could they afford that food? So there were factors in that as well, but it was really the proximity to food and access.
Okay, and now I remember the other part of I didn't realize I was going to have time to actually ask you, so I made some notes. The Greater Newark Conservancy has told us that they often can't get fresh foods into schools because of contracts between the Newark Public Schools and the service providers. Has anybody looked into that and help us with that?
Yeah, so that's not controversial.
But no, it's not controversial.
Not at all.
It's a problem.
So the way that it works, and we have both Margarita Munoz, who was the former deputy mayor of Newark, who chaired the Let's Move committee for Mayor Booker, as well as Beverly Lynn, who runs program for parents, who also looks at the contracts for the preschool providers. So the issue around the contracts is that they are required to accept the lowest bid. And so as long as that school is providing breakfast and lunch for a certain rate, they have to accept that. And then there's the other issue, the flip side of that is not just accepting the contract. So for example, schools that have kitchens that aren't utilized, they're literally just heating up meals that are brought in. They're not actually cooking real food. So one of the videos I didn't show you is that there's a chef in Berkeley who took over the Berkeley Public Schools who literally eliminated all the contracts and literally started cooking food in those kitchens. And so we've talked about that as well in the committee work, and one of the issues is that it's extremely expensive because there's certain federal and state regulations around not what you can cook, but how it's cooked and how it's prepared and things like that. So especially for the preschools, in terms of what their capacity is, some of the schools, the K through 8 schools and the high schools, of course, have kitchens. But like I said, those contracts are awarded to the lowest bid, and so they are legally required to do that. So we're sort of dancing around how do we open up that can of worms without really opening up that can of worms. That's really what the challenge is. So when we talk about adopting a local food policy through the municipal council, perhaps skirting around some of that issue for we demand our kids have certain nutritional standards that are met, that are not being met by breakfast and lunch. And SEAL's work around getting kids breakfast was huge. Now we want to make sure that what they're getting is actually nutritious and feeding their brain so that they can grow and learn.
Thank you.
You're welcome.
Marcia, thank you for your question, because I think it was sort of emblematic of how complicated sometimes these problems are, but it's asking the question and challenging the status quo of where we are that's unacceptable for our kids. I think ACNJ has been doing that for years empirically so that we can rely upon the data to make some decisions, but it's, and, not but, and it is also collective leadership to say, I get the contract, I get it, but the outcomes for our kids are unacceptable. So how do we change that? Whether it's a state regulation, if it's a federal regulation, or if it's a city, and I think we've got committed leadership in this city to do exactly that. But sometimes it takes a number of us coming together.
So there's another level of complication that there's no way we can solve here, but I just want to throw it out. There was a film shown at NJPAC a couple of years ago called A Seat at the Table. And one of the things that it emphasized was federal farm subsidies and how they subsidize grains and not vegetables and fruits. And that makes grains cheap and fruits and vegetables relatively more expensive. And that has a huge impact on what people can afford and what they find.
You're right, you're right. Which is why, so again, you had the tip of the iceberg of the impact team work here because everyone will hear this together. The breakout sessions are designed to go exactly deeper and really come out with a series of questions and commitments so that collectively and you'll hear this during lunch, we do move this forward. So thank you, that's exactly the kind of question that we really need to grapple with. If it were easy, and honestly, if it were easy and were only about, if the results came about because of people's love for this city, commitment to its kids, wanting to achieve success here, been done a long time ago. There's a lot of great leaders who are really committed to doing this work, but it takes us doing it together collectively. And and also involving the city, as disability rights advocates often say, not about me without me, right? So we have to make this decision also in conjunction with the residents of the city. And we're going to do exactly that. We have a plan for that as well, which you'll hear about a little bit later. One more question, sorry, maybe, okay, sorry, sir? Either a booming voice or a mic.
I probably could do both. Oh, thank you.
Both, thank you.
Get my chest ready. Dan DeNose from Newark Public Schools, Family and Community Engagement. You all did a phenomenal job up there as a panel. But for Rhonda, my question is, in terms of the home, are you taking into account the idea of what happens in the home could also leak outside of the four walls of the home? So what about the cleanliness of their neighborhood itself? What about littering and trash? Are you also considering that as a possibility of being a healthy Newark?
Yes, like you saw in the video, one of the gentlemen talked how the lead dust was on the grass. And so attacking the home and the outside of the buildings is something that we're talking about, as well as even in some play equipment, unfortunately. Some playgrounds are closed down because they found out that the paint on the equipment was lead. So, one of the things I think maybe Denise talked about the Kaboom Park in Fairmont. When we are redeveloping that park, that's something that we will take into consideration about what types of play equipment, if it's free of lead and other toxics. So while we say a healthy home and 90% of the people or kids spend time indoors, we are also examining where they go outside. Like, you know, all my partners here, we realize that it's a comprehensive approach and we all impact each other. And so being able to go out and play, we have to have, you know, safe and non-toxic play equipment, et cetera.
Thank you.
Thanks, Rhonda. Thanks for that question. I thought I saw one other straight ahead of me.
Excuse me, ma'am.
Oh, I'm sorry, we have to get you a mic. Thank
Hi,
you.
everyone. Marlene Fox. I said right, that was mine before I got married. Marlene Fox. Don't tell my husband, okay. Marlene Fox, the Harlem Children's Zone, and we ran a Healthy Harlem program for many years in Harlem. So I have a question. Are you guys doing anything with teachers? Because I hear over and over how teachers use food as a punitive, in a punitive way, so children don't get snacks if they misbehave in class. Or have you done anything with teachers to help them to know how to use food if there's a birthday or some other type of celebration? So I just wanted to know if there's any training around the teachers and what they do in the classrooms.
So we, that's a really good point.
It is.
That's like a goal number 4. We're on goals 1 through 3, but I'll write that down and we can look at that at a later date. But that's a really good suggestion. We haven't done that yet, and I can't comment on to the extent of if that happens or not. I surmise that probably sometimes it does, may not. I don't know, but it's definitely something we can look at a later date.
So in the healthy homes, one of the things working with the early child care centers is making sure the kids are being tested for lead. So.
And I would just also add that I think the training and partnership with the schools, to the point you just made, falls into the trauma-informed care space as well, because it's a change in mind shift. If it is existing, I'm not personally familiar with whether that practice is happening here in Newark, but just setting an expectation of how a classroom is an environment and how we can work together to optimize learning and teacher sustainment and self-care and the teacher's quality of the experience as well. So I think that falls into multiple impact teams, so thank you for raising it.
And in the guise of shamelessly stealing from the Harlem Children's Zone, seriously, this shouldn't be about reinventing a wheel necessarily. What might work for one community could well work for ours, and so maybe join that afternoon breakout session and bring that thought there as well. So I don't want to end any questions, but I want to say let's continue the questions into the breakout sessions a little later on this afternoon. So just so we stay on time, we're scheduled right now to take a 15-minute break and to come back promptly at 10:45 if you would, and we'll continue with our plenary address. Thank you so much, everyone.